Okay, let's talk about antivirals and coronavirus. There's a big conversation about what type of therapeutic treatment might best work for coronavirus until we have a vaccine. There are all sorts of different things being tested using convalescent plasma to put the antibodies of recovered people into the bodies of those who are sick. There are all sorts of different types of medications, but one is antiviral. So remdesivir is an antiviral that is currently the subject of a number of randomized controlled trials. Avigan, also known as favipavir, that's a mouthful, is another antiviral that's being tested. And what it is increasingly looking like is that to get these medications to work at their best, whatever the best will be, we're probably going to have to start administering them much earlier in the disease progression when the patient is less sick. And we're going to talk about why in just a moment. But just to sort of orient the conversation, there was this randomized controlled trial of remdesivir. We got the results from it last week. It was given to patients already in serious enough condition to be hospitalized. About 1,000 people were part of this RCT. There was a placebo group, and what the study found was that the duration of the virus was reduced by about 30% in the group that received remdesivir compared to the placebo group. Very good. That's something. 30% is important. We know less about whether remdesivir was saving people who otherwise would have died. The results were not statistically significant on the mortality. But one thing in general is that antivirals work better when they're taken earlier. And it's not a problem per se, but it presents a challenge with remdesivir, which I'll tell you about in a moment. But as a general rule, antivirals work better when they are taken earlier. The earlier, the better. Look at the flu, influenza, and Tamiflu. Tamiflu is recommended within 48 hours of onset. Not if you've had it for days, not if you're so serious from the flu that you have to be in the hospital. That's considered too late for Tamiflu to work at its best. Ideally, you start Tamiflu within 12 hours of starting flu symptoms. If not, you want to start it within 24 hours. If not, absolutely, you want to be on Tamiflu within 48 hours. And the reason why is inherent in how antivirals work. Antivirals don't come in and destroy the virus or kill the virus, so to speak. Antivirals prevent the virus from replicating. When we talk about viral growth, we're talking about not only the spread of cases, but imagine that you have 2 viral cells in your body. They replicate and become 4, and then 8 and 16 and 32. I think you sort of get the idea. What the antiviral does is it prevents the virus from continuing to replicate while the body can fight the virus. The longer you wait, the larger the viral load in the body when you introduce the antiviral. That's why you want to start it earlier. And that's why remdesivir may work significantly better if we were giving it to people earlier. What's the problem with that? Well, the problem with remdesivir and coronavirus is that remdesivir is an intravenous therapy. It's given at a hospital for people who are not only well into the disease, but sick enough to already be hospitalized. There's also potentially remdesivir supply issues, but it would be very difficult to give, you can't give everybody a remdesivir pill as soon as they test positive for coronavirus. There's also a limited supply of hospital equipment to be doing the IV infusions. You need staff in order to give IV medication. There's not room at hospitals to give everybody remdesivir intravenously as soon as they test positive. So this, of course, is all assuming that it worked, but these are the conversations we're now having about antivirals. So the upside is that because antivirals tend to work better when given earlier, the study that said remdesivir shortened disease by 30%, we may be able to do way better than that. Sick patients can do better with it, but early in the disease, it may actually do even more for people who have coronavirus. The downside is an IV drug is tough to start giving to so many people. And since it's done in a hospital setting, we don't have the space, nor the resources, nor the staffing to give everybody remdesivir when they test positive. Maybe if the supply is increased, you could give everybody in high-risk groups the medication if it continues to prove effective And meanwhile, we're continuing to have other Remdesivir trials. It's been opened up for emergency use by the FDA. And additionally, we're also testing Kaletra. Kaletra is a combination of two HIV drugs. Avigan is also being tested. That's another antiviral. So that's the latest. But a growing conversation is maybe the antivirals have to start earlier and thus may be much more effective. Hopefully, there will be tests done of that sooner than later.